Good afternoon, everybody. I'm Professor Michael Kidd, Deputy Chief Medical Officer with the Department of Health. And with me today, I'm very pleased to introduce Australia's newest Deputy Chief Medical Officer, Dr. Sonya Bennett. Sonya is a familiar face to many of you. She's a very eminent public health physician and until recently was the Deputy Chief Health Officer for Queensland Health. Today we're going to provide an update on what's been happening with vaccines and also an update on the figures for the country and the Commonwealth support for the people of Western New South Wales. So far in Australia we've seen more than 15.8 million doses of COVID-19 vaccines administered to the people of our country. Over the last 7 days, 1.7 million doses have been administered to people in Australia, and that is more than the population of Adelaide and Darwin combined. Obviously, we're encouraging everybody to get vaccinated, and that of course includes anybody who is in lockdown. One of the reasons you're able to leave lockdown is to attend to get a COVID-19 vaccine. So please join with millions and millions of other Australians in getting vaccinated against COVID-19. Yesterday we had 273,800 doses of COVID-19 vaccines administered across the country. We now have just under 50% of the total eligible population of people aged 16 and above in Australia who've received at least a first dose of a COVID-19 vaccine, and 27.5% of people are now fully vaccinated in our country. The very good news is that more than 83% of people aged 70 years and above have now had at least a first dose of a COVID-19 vaccine, and more than 78% of people aged 60 and above are now protected also with a first dose. Since the National Cabinet meeting on Monday the 28th of June, over 355,000 Australians under the age of 40 have turned up for a first dose of an AstraZeneca vaccine, and many of those are now receiving second doses as well. Importantly, we now have over 67% of all people working in residential aged care facilities across the country who've received at least a first dose of COVID-19 vaccines, and 46% who are now fully vaccinated, having received both doses. We're seeing very significant uptake among the people working in residential aged care facilities. We've been offering the vaccine widely, and now we're seeing very rapid uptake of the vaccine amongst that workforce. Much of the previously reported hesitancy is melting away amongst people working in residential aged care. I'm now going to pass to Dr. Sonya Bennett.
Thank you, Michael. Good afternoon, everybody. As Michael said, my name's Sonya Bennett, and I've been the Executive Director of Communicable Disease in Queensland for some time, more recently the Deputy Chief Health Officer. And then for the last 2 years I've also chaired the Communicable Disease Network of Australia, which is the policy advisory committee into AHPPC, and in that role sat on AHPPC. So I'm very pleased to have recently taken on the new role here for me of Deputy Chief Medical Officer, and to continue to support both the strategic and policy work into this next phase and phases of the pandemic that we're going to see. So today I'll just outline, really give you an update on the case numbers and the epidemiology in Australia, and then hand back to Michael, who's got some more information for you. So I've note today in Australia we had a total of 685 confirmed cases, including 6 overseas acquired cases, but the vast majority, 679, were locally acquired. Of those 679, 633 were in New South Wales, 24 in Victoria and 22 in the ACT. And New South Wales Health officially reported 3 COVID deaths, related deaths in the past 24 hours. So just briefly to summarise Victoria and the ACT first before we turn to New South Wales. So of the 24 locally acquired cases today in Victoria, the vast majority were known contacts, and 4 are still under investigation, but all were in Metro Melbourne, and that's good news. And that brings their outbreak to a total of 253 cases. In the ACT, of the 22 locally acquired, all of those were close contacts, and that's really very good news, and sort of indicates that with the restrictions in place in the ACT that have been introduced recently, we can see some of those cases start to be brought under control as the vast majority of those cases were exposed before the lockdown. And as we turn to New South Wales, there have been a total of 9,280 cases in this outbreak reported since the 15th of June. And of the 633 locally acquired today, 158 were contacts of a confirmed case and 145 are household contacts. We know that household transmission is a big risk, and the others remain under investigation. But a large number of those were infectious in community, and of the remaining 475 under investigation, I think we can expect that many of those will have also been infectious in the community, which will obviously put further exposures out in the community. Of the locations, they're similar numbers to what we've been seeing. 237 cases were from southwestern Sydney local district, 211 from Western Sydney, 17 from Hunter, New England, 47 from Sydney LHD, and 24 from southeastern Sydney, 54 in the Nepean Blue Mountains area. And it's those cases really in Western New South Wales that we're concerned about, because as we know, a large proportion of those are in the Aboriginal and Torres Strait Islander communities. So whilst New South Wales is obviously a concern, and if we compare it to the Victoria outbreak last year, it's following a similar trajectory, but we have to, where Victoria at this point in their outbreak last year had 492 cases, but we have to remember that this is the Delta variant. It's much more infectious than the strain we were seeing in outbreaks last year, and the restrictions to date have managed to continue to suppress the numbers, but what we really want to see obviously is a downturn in those numbers, and with the restrictions put in place more recently on the weekend for the whole of New South Wales and introduced on Monday, and with the vaccination program, as Michael has just outlined, gaining momentum, both the program and the uptake of vaccines, we're really expecting to see and anticipating that we will see a decrease in those numbers shortly, because the restrictions recently across the state would really are yet to take effect. We haven't had enough time to really see the impact that it will have had on exposures. Thanks, Michael.
Thanks, Sonya. So just a few words about the work that the Commonwealth is doing to support the people of Western New South Wales. On the 14th of August, the Chief Medical Officer, Professor Paul Kelly, declared the whole state of New South Wales as a hotspot for the purposes of Commonwealth support. And since that time, we've been working very closely with New South Wales Health and with affected communities to look at how we can strengthen the response to the COVID-19 outbreak in that region. Amongst the initiatives which have been put in place has been a number of additional general practices which are now providing the Pfizer vaccine to their communities. This includes general practices in Dubbo, Lightning Ridge, Brewarrina and Bourke, and also an additional Aboriginal community controlled health service in Bourke, which is now providing the Pfizer vaccine to people as well. We've had additional point-of-care testing made available across the region. The advantage of point-of-care tests is that a result can be obtained very quickly, which means that we don't have to send specimens off to capital cities in order to get results on whether people are positive or not. We've provided additional support for testing to the general practice respiratory clinics right across the area, and there are general practice respiratory clinics located in Bathurst, in Broken Hill, Cobar, Cowra, Dubbo, Mudgee, Orange and in Walgett, where people can be assessed if they have respiratory symptoms and, if appropriate, be tested for COVID-19. We've been providing additional personal protective equipment through the local primary health network to the healthcare workers of the region. And I wanted to pay particular credit to the Royal Flying Doctor Service, which has activated its plans for emergency response, and also to be able to evacuate people from the region if people do become seriously unwell and need to be transferred to larger centres or to the capital city. And the RFDS is also supporting the vaccine rollout in a number of towns across Western New South Wales. And finally, the Australian Defence Forces have also been deployed to Western New South Wales, and from Friday will be involved in establishing pop-up vaccination centres to increase opportunities for vaccination of the people of the region. That's our update, but happy to take any questions.
Professor Kidd, can Sonya in Western New South Wales is extremely remote. There are a lot of people with pre-existing health conditions, and more than half the population are Indigenous. Those three factors alone mean that a lot of that town, well, the whole town has effectively been eligible for a vaccine since March. Isn't it too late now to be sending AUSMAT and the military and the flying doctors into the region after COVID has already got in? What went wrong here?
So thank you. So it's never too late for people to get vaccinated against COVID-19, and we're urging everybody, if you're in an outbreak area or if you're in other areas of Australia, not to delay getting vaccinated. We did hear this week from Minister Wyatt about challenges with vaccine hesitancy among some communities across Australia. What we've seen, of course, is that vaccine hesitancy is markedly reduced when outbreaks do occur. We saw that happening in Victoria earlier in the year. We've certainly seen this happening across New South Wales as well. But as I've outlined, we have very extensive services supporting people in Western New South Wales, and most importantly, working with the leaders of the Aboriginal communities and also the leaders of the Aboriginal community-controlled health organisations on the response.
But it's true
Professor,
that
it may well be too late for some of those Indigenous communities. So what is it that you're doing differently? And you need to acknowledge that it is very late in the piece to be paying attention to them. Indigenous communities in the last major outbreak managed their own lockdowns without a single fatality. But also there are reports today, I was hoping you could comment on, in Wilcannia, a funeral attended by a woman from Broken Hill. It had 150 people present, and they were mostly Indigenous.
Thank you. So obviously there's been a very concerted effort right throughout the pandemic working with Aboriginal and Torres Strait Islander people across Australia. And this has been happening for the Commonwealth through the advisory group which was established with Aboriginal and Torres Strait Islander leaders right at the outset of the pandemic, and there have been initiatives which have been rolling out, led by communities, right throughout the pandemic. Of course, we've had vaccine rolling out in many of these centres, but what we've done over recent days is to ramp up even further the opportunities for people to be vaccinated against COVID-19. I'm sorry, I don't have details of the funeral service in Broken Hill.
Also, the age of infection is trending lower, and in the ACT I think it's just dipped into the teens. So at what stage will TGA approve vaccinations for 12 to 15-year-olds and also look at a younger age group?
So the TGA has approved the Pfizer vaccine for use in children aged 12 and above, and as you'll be aware, the priority populations for getting the vaccine amongst children at the moment are children aged between 12 and 15 who already have a chronic health condition that would put them at increased risk if they were to contract COVID-19, plus all Aboriginal and Torres Strait Islander children aged 12 and above in Australia, and children aged 12 and above living in remote communities.
That doesn't cover children in cities. That doesn't cover a lot of children living in capital cities.
That's right. So the priority at the moment.
All children under 16?
Yeah, the priority at the moment is the prioritisation groups which have been established by the Australian Technical Advisory Group on immunisation. Obviously the biggest protection that we can provide to the children of Australia, and it's essential that we are protecting all children, not just those aged 12 and above, but all children, is by preventing them from being infected with COVID-19. And that's why it's so essential that people are adhering to all the public health measures where they're based and located.
Professor Kidd, New South Wales is citing compliance as a major issue in terms of getting those numbers down. But a lot of these cases are occurring when people go to the shop, when they go to work, when they do all of these permitted activities. Is the fact that 400 people were caught breaking the rules yesterday really going to have any bearing when the virus is as spread as it is?
Response as well as case numbers increases will change. And it's all, and again, a number of those factors. The vaccine does that by obviously providing individual immunity to that person, and that protects them from severe disease. But is also, whilst we know vaccinated people can still get disease, they most typically don't get severe disease, and whilst they can still transmit the infection, they don't transmit it. They're not as infectious as people who aren't vaccinated. So that's the impact we need to see from the vaccine. But again, despite vaccination coverage, all those measures will still be in place. And even when we're in a business as usual environment, if you like, we will continue probably to see local outbreaks of COVID that public health will respond to, and people need to continue to consider their own individual need for protection against COVID.
And I'm not sure if this
Last question.
on Dr. Kidd, but just the Moderna has been approved for use, and we're expecting the first supplies to arrive next month. Where is the task now in terms of deciding who will actually be eligible for that vaccine?
Yes, so ATAGI is going to be meeting and doing its deliberations about Moderna, and we already have, of course, the TGA approval, and ATAGI will provide us with advice about which age groups are the priority for that vaccine. Thank you, everybody, and thank you to our interpreters. Thank you.
Just a